this meeting will be conducted via remote means. Members of the public who wish to access the meeting may do so in the following manner. For a Zoom meeting, see connection information on the agenda to join the meeting by Zoom video conference or by calling in by phone. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the Topsfield Town website at https://www.topsfield-ma.gov. You may also reach out to the Topsfield Board of Health at health@topsfield-ma.gov or 978-887-1520 for information or assistance. No in-person attendance of members of the public will be permitted, and public participation in any public hearing conducted during this meeting shall be by remote means only. Is Topsfield Cable here?
Yes.
Yes. Okay. So Topsfield Cable TV will be recording this meeting. Is there anyone else who wishes to record the meeting? Could you just raise your hand if you want to record the meeting? I don't see any hands raised. Does anyone see hands raised? I can't see everybody. Maybe I need to change the view gallery. Oh, there we go. Okay. Now I can't see my, okay. So, we usually open with a moment of silence, so we'll go ahead with that. Thank you. The first appointment is Northeast Massachusetts Mosquito Control, otherwise known as NEMIC, and they have a slideshow presentation, which we are very glad to see because I don't recall ever seeing this slideshow in its entirety. So we're gonna, I've looked at it in advance. Some of you may have looked at it in advance, but it's going to be good to hear it in person. And I hope we need all to pay very close attention because we will be voting on this later in the meeting on accepting the best management plan for Topsfield for 2026. And so we need to get all our questions answered right after the slide presentation and while the mosquito people are here on our meeting. So thank you. So let's see, Jennifer, who's going to give this slide? There you are.
Hi, Jennifer Sforza, the office manager and Board of Health liaison. And with us, we have Kimberly Foss, our entomologist, and Barry Noon, our district director.
Thank you. Jennifer, are you going to share your slides or do you want one of us to do it?
I think I can share
because
here.
You can share your screen. I think John gave everybody permission to share their screen.
Yes, I think we can do that.
Super. Okay, take it away, Jennifer.
All right, I think Barry's going to start us off and we'll kind of switch off going through the slides.
Super, thank you.
So thank you everyone for joining us tonight. We appreciate it. If you don't know me, my name is Barry. I've been with the district just over 15 years. Kimberly, our entomologist, 10 plus, and Jen going on her 6th year. So we've got a good mix of experience with the district. And with that, the first slide, I'm going to hand over to Kim, and she will jump right in on our IPM.
Okay. Integrated pest management is a circular, environmentally sensitive approach that uses cultural, biological, and chemical control methods based on pest life cycles and environmental conditions. Our program integrates identification, surveillance, prevention, and targeted control strategies to manage mosquito populations and reduce public health risk. In 2025 in Topsfield, 37 mosquito habitat inspections were conducted and 960 catch basins were treated, resulting in a 53% reduction in mosquito populations. No arboviral positives or increased risk were detected in Topsfield during 2025. And again, just to remind everybody, West Nile virus is prevalent in hot, dry years, and it's usually urban. And EEE is usually prevalent in cooler, wet years, and it's usually rural. In 2026, so far, we've done 17 habitat inspections completed to date in Topsfield and targeting spring mosquito breeding. Control decisions are guided by surveillance data, action thresholds, and the use of lowest risk and treatment options available. The program includes education, source reduction, habitat management, biological control, and targeted insecticide use when necessary.
Kimberly,
Yes.
do you need the slides to advance as you speak? Because are you still on the first slide?
Yes, Jen will continue.
Jen will. Okay.
Yep, Jen, you're all set to change.
Okay, thanks.
All right, and I'm going to go ahead and touch on our website reminders. It's been a few years now since we revamped the whole website, trying to make it a little bit more user-friendly. So just real quick, first and foremost is our most used button, Request Service, where residents can go in and request adulticiding if their community allows it with us, larviciding, tire requests where we can go out and pick up tires. Next would be the spray exclusion, where property owners can go in and have their property excluded. That would be, we'll get into a little bit more detail further down, but if we're, say there's virus found and we're doing a target area, if somebody's home is excluded, the sprayer will turn off at the property line, turn back on when they get to the other side. So that's something everybody has the option to do. Pesticides just goes over every product that we use. FAQs, well, you'll find FAQs in regards to all the services we provide, how to protect yourself, questions on repellents. Same with protect yourself. There's a little more information there, what you can do to kind of reduce the mosquitoes around your home. Notify me would be, Notify me would be more for when we have our news and announcements. If somebody wants to sign up for those, they can go ahead and put in their email. When we have announcements that go out, they can automatically get them to their emails. Kim, if you want to touch on the prevention and personal protection.
So our education and outreach program follows state guidance and on reducing mosquito exposure through source reduction and personal protection. Our residents are encouraged to use EPA and CDC-approved insect repellents, wear protective clothing, and limit outdoor activity during peak mosquito hours, which is usually dawn to dusk. A key focus is eliminating standing water around homes, including bird baths, gutters, pet dishes, pools, tarps, and other containers. Even very small amounts of water, such as bottle caps, can produce a large amount of mosquitoes. In 2025 in Topsfield, one residential property inspection service request was completed. These inspections help us communicate with residents and discover new breeding sites not previously mapped on our GIS systems. Boards of health are also encouraged to call us to inspect and larvicide abandoned properties, including unused swimming pools. We also collect tires. Barry will reach on that later. Residents are also encouraged to maintain windows and door screens and properly store outdoor items to prevent water from collecting. Slide. That's you, Barry.
So property inspection requests. Massachusetts General Law 252 are enacting a legislation in coordination with Mass DPH, authorizes mosquito control districts to conduct prevention, management, and eradication services as needed. Residents and Board of Health may request property inspections for mosquito breeding concerns, standing water, ditches, wetland pools, vacant properties, abandoned pools, anywhere breeding is found. Larviciding treatments may be applied. We also take abandoned tires, which Kim mentioned earlier. Following the inspections, residents receive a door hanger notification and or a Board of Health follow-up with a written summary with our recommendations and what we found.
And surveillance is the foundation of any mosquito control and disease prevention program. Massachusetts has about 52 to 54 mosquito species, all monitored through larval and adult surveillance. Larval surveillance identifies and eliminates breeding sites before adult mosquitoes emerge. Adult surveillance tracks mosquito populations, species distributions, and disease risk. In 2025, in Topsfield, 37 habitat inspections were completed. and mosquito populations decreased by about 53% overall. In 2025, 16 mosquito samples were tested for West Nile and Eastern equine encephalitis. All were negative. No arboviral positives or increased risk were detected in Topsfield. In 2026, adult surveillance in Topsfield will begin the week of May 11th and run through the end of September, with testing beginning in June and continuing longer if needed. Historically in Topsfield, the last EEE isolation occurred in 2014. Since 2011, there have been 5 EEE isolations and 6 West Nile virus isolations in Topsfield. And we continue to guide surveillance and response. So we use quite a bit of different kinds of traps, and the map that you'll see on the screen shows about where our distribution is for the traps that we have throughout the district. And each cover quite a large radius, and they're primarily placed in secure zones near areas where we're going to get mosquitoes and where we might have population centers or areas at risk like schools. We use CDC CO2 light traps, and those are on poles. And those are mostly used for trapping bridge vector species, which are human biters. They're kind of our second line of defense for when virus peaks. We have gravid traps, which are for early detection of West Nile virus. They collect gravid female mosquitoes, Culex pipiens usually, which are bird biters. Those are what we usually see early in the year when we see state positives. So most of the state positives that come out are usually in Culex pipiens. It gives us about a 2-week window to get our, start larviciding and things like that to try to reduce the pipiens population. Catch basins is a major contributor to that. We treat catch basins really early, and Barry will speak about that later. But usually we'll see it in bird biters first. It's kind of the same thing with EEE. And it gives us some time to start setting out supplementals and really focusing on what we're going to submit for DPH to test for the human biting mosquitoes. We also have overtraps. We don't do overtrapping in Topsfield yet. Usually we set those out for invasive species such as Aedes aegypti or Aedes albopictus. And we track those. Right now, we're only seeing it in southern Massachusetts and some of our coastal regions near our urban centers. And then for EEE, we use resting boxes, and they're these little plant pots, and they mimic the crypt habitat that Melanura lives in. And we place them in usually sphagnum bogs or red maple swamps on kind of the pine upland. And we set out 8 in each site, and we have 2 locations in each town that usually has the EEE risk. So these traps won't be in the urban centers like Revere and Saugus. They'll be along the New Hampshire border and wherever we have large habitats where EEE has been identified in the past. We put out supplementals. Sorry. So we deploy those in Topsfield or any other community after the first detection of West Nile or EEE. They're CDC CO2 portable light traps. They're not on poles. They're not attached to power supply. They run off a battery. We bring a portable tank out, and they're usually quite hidden, and they're only put out overnight to collect near the radii of where the positive mosquito was collected. We also use them to check our efficacy on our treatments for adulticiding on occasion. And then we'll also use them if residents or in an area of town have a lot of complaints and I want to see where they're coming from and what species. So it's really interesting because each species has its own habitat. So if I can put a trap out, collect the mosquitoes, I know where they're coming from by the habitat type. And that's you, Barry?
Yep, I was muted.
That's right.
Habitat mitigation is one of the first lines of defense we use in mosquito control. It's a core part of what we do, which includes ditch maintenance, wetlands management, and invasive plant control. In the past year, the district has cleared over 53,000 feet of stormwater ditches and cleared 127 culverts district-wide. Improving drainage and reducing stagnant water where mosquitoes breed. Approximately 617 abandoned tires were also removed throughout contaminated cleanups and with resident requests. As Jen mentioned, that is a tab on our website that residents can click on. We limit it to around 10 per household district-wide because the numbers add up quick and they are very expensive to dispose of. We also do management of invasive Phragmites. It's a dense growth that creates mosquito breeding and resting habitat and can limit access for us. So we do have some mowing programs near the MBT lines down in Revere and Saugus, in which we can mow in the fall, and then we can use our special equipment to go in and treat those areas in the spring. These efforts are essential part of integrated mosquito control and reduces the reliance on chemical control. If there are big mitigation projects, we do ask the town for a petition, and Steve, our wetlands coordinator, usually handles those, and those can come from either the Board of Health or the DPW. Next is our general larviciding program. Larviciding is the primary chemical control method when habitat modification isn't sufficient and is the most effective before mosquitoes emerge as adults. Treatment begins in March, weather dependent, and continues throughout September with year-round targeting possible, especially in Melanura overwintering habitats, which Topsfield has quite a few alongside Ipswich as well. Field teams inspect sites, treat when larva densities exceed a threshold level. In 2025, large-scale larval control supported broader program outcomes, including a 50% reduction in mosquito populations. I do add that all the pesticides for larviciding that we do use, and Kim will touch on this, are EPA regulated, pesticide board approved, and put through a rigorous methodology with the Endangered Species Act before we're even allowed to use them. Next is our catch basin program, which Kim also touched on earlier. Catch basins are the primary source of Culex mosquitoes, the main West Nile virus vector in urban areas. These systems provide stagnant water, organic material, and protection from predators. Treatments are timed to target peak hatching when water temperatures reach 70 Fahrenheit. Annual treatments can reduce the populations by 80% compared to untreated basins. In 2025, 960 catch basins were treated in Topsfield, reducing the population by roughly 53%. Treatments begin in late May throughout June. We prioritize higher risk municipalities, including areas north of Boston, bordering Lawrence, and followed by the remainder of the district. Municipal catch basin cleaning before May or after August improves larvicide effectiveness. We do reach out to the DPW, in this case, Gary, in early spring to find out when the cleaning periods will be done so that we're not treating and then he's coming in and cleaning and then we're wasting the product. So we do communicate with all the DPWs in the district.
There we go. So I want to touch on some of our products. All our products that we use are EPA registered category 4, meaning they have very low toxicity. We also have a memorandum of understanding with the Heritage Bureau, with the Massachusetts Heritage Bureau. We also have an EPA, which is with the Clean Water Act. We carry a NPDES, a pesticide discharge permit, and they have all our listed methodologies and products that we use, and we have to It's quite a large document, which is a public view. If anybody wants to see it, we have it on our office. And we follow those federal regulations as well. So to mention it again, in 2025, 960 catch basins were treated, and we also did 750 feet of hand ditch maintenance. We start our freshwater larviciding treatments in April, and catch basins are scheduled for June of this year. We primarily use bacterial larvicides such as BTI and Bacillus thuringiensis, which specifically target mosquito larvae through ingestion and are safe for people, pets, and wildlife, and beneficial insects. These products work best in clean, low debris water because high organic material can compete with the product when the larvae are feeding. Methoprene is preferably used in heavy organic or debris-filled habitats, such as above-ground containers and unclean catch basins and like dirty swimming pools, the green kind of swimming pools, and sewage basins and things that have a lot of high organic components in it. When there's larvae breeding in there, which is primarily the only thing breeding in those sites because of the low oxygen content, we have to use methoprene in those areas because the mode of ingestion for larvae, it doesn't work for that because there's too much competing organic material. So the methoprene reacts with the, it goes through absorption of the surface area of the larvae. And it works as an insect growth regulator. Methoprene does not generally affect fish, birds, and mammals, including humans and pets, adult insects such as bees and other beneficial pollinators, or most aquatic vertebrates. Methoprene is primarily used to control larvae, fungus gnats, and black flies. A lot of them, like Connecticut, will use methoprene in rivers to treat black fly larvae. In real-world mosquito control programs, it's considered very low risk to non-target organisms. We don't usually use it in groundwater anyway. We use it in catch basins, which is considered stormwater, and we use it in containers. We save our bacterial larvicides for anything that's waters of the US. We'll also use surface oils such as cocoa bear. We use those for late stage larvae. So larvae have 4 stages. There's first, second, third, fourth instar, pupae, and then it goes to adults. This product is usually good for fourth instar larvae because they stop feeding, and pupae because they don't feed at all. So we use a mechanical product that puts a thin layer on the surface water. And since mosquito larvae breathe through a siphon, they have to break the water surface tension. And what this product does is it basically suffocates them so they can't breathe. It clogs up their tube and then they drown and die. All applications in Topsfield are carefully targeted with and performed by trained technicians following strict label requirements. And again, each stage of mosquito has this particular product. We rotate products so that we don't get, we have higher efficacy and we don't get resistance. So we have to really be careful for resistance, pesticide resistance in mosquitoes. There's many generations within a year. So we have to sometimes rotate products. We also go through a resistance testing program where we send mosquito larvae to a lab and they test it against different types of mosquito products to see if we either have to switch or what kind of resistance our mosquitoes have.
Next, we have adulticiding or ultra low volume truck-based spraying, which is used for virus response in coordination with local boards of health or resident requests, which we do in 15 other towns within the district, not in Topsfield. Applications use an extremely low pesticide volume, approximately 1 ounce per acre, and are conducted at night, 30 minutes after sunset, to protect pollinators. All our sprayers are calibrated every year to the micron width of 30 to calibrate specifically for an adult flying mosquito. One of our products we use is Zenivex E4. It's a reduced risk pyrethroid that provides rapid knockdown of flying mosquitoes and contains no PBOs synergists. UVL treatments are a non-residual and only affect mosquitoes present at time of application. They are mostly effective during high nuisance periods or confirmed virus activity. All applications are not conducted during rain, winds above 10, or temperatures below 50 degrees. All our trucks have onboard weather stations, tablets that show the exclusions of property in the area, the buffers for when to shut off and turn back on, all the NHESP layers from the Endangered Species Act, all the way to drinking water areas, so that our techs can see everything, what's going on, and where they should or shouldn't be applicating. Only the local boards of health in Topsfield can authorize a UOV operation. One of our next treatments is barrier treatments. They provide a longer lasting mosquito reduction in public use areas such as parks, schools, playgrounds, and athletic fields. Products such as Suspend SC or Polyzone are a deltamethrin synthetic pyrethroid applied to vegetation, structured surfaces to reduce mosquito activity in those zones. Treatments are conducted at night, beginning 30 minutes after sunset, and re-entry is allowed when it's dry or usually in the morning. Applications are not conducted during rain, wind, or temperatures below 50 and are not for private resident use. Barrier treatments are recommended prior to peak virus season to reduce mosquito pressure in high-use community spaces.
All right, so here we come on to the Board of Health or Health Department adulticide requests. So if this is something that Topsfield wanted to do, or any of our member communities, we do have some communities that put in weekly requests for all their public parks in different areas. We do request to, our preferred request is to have it done through our municipal toolbox, which is when you're on our website, it's in the upper right-hand corner. When you put in the request through the municipal toolbox, it'll just let you know like where you want to have it done. You just fill in that information. The bonus of having it done through the website is if somebody's not either sitting at the desk or manning their personal email. For example, if you sent it directly to me and I was out of the office, I may miss it. So sending it through the website, it'll go through our general mailbox, which is the NEMMC@mass.gov. It will go to our field crew supervisor, and it will also go to Barry so that we won't miss your requests. Let's see. So there are many times that we may receive these again. Sometimes it's just weekly for nuisance in certain public areas. It may be in response to virus, which we touched on earlier. It all depends on what the town wants. I believe Topsfield has the preventative done once a year, specifically over near the fairgrounds and a couple other areas in town. Well, IPM program is something that we have to follow for the Children and Families Protection Act. It's mandatory for any mosquito control pesticide activity at any of the public and private schools and daycares over 10 children. There's a specific website for that. You can go in, and if you want to know if there's an IPM plan for your town and any of the particular schools, you can look by Topsfield. You can search by the name of the town, of the school. As a reminder, if there was something to pop up in Topsfield and there was treatment requested, the IPM, the outdoor IPM plan has to be updated with our products. If it's not there, we can't do it. I will coordinate with the IPM coordinators to make sure everything's up to date, help walk them through. What we do ask from the board is if you happen to know that there's a new person taking over as the IPM coordinator, just give us a heads up. Sometimes it's not always updated online. We may reach out if we need help tracking somebody down if the schools are unresponsive. The resident adulticide request, This is not for Topsfield. Topsfield at this time does not allow us to come in for resident requests. If that were to change, it's just a vote from the Board of Health. That would be where a resident could go on our website, put in their property, and we could go in as they felt they needed it weekly during our season. Let's see. That's pretty much it for the adulticide request for the residential one. If there's any questions on that, we just have everybody, either if they can't find the information on our website, to give the office a call, send us an email. We did run into some challenges last year in regards to some of our operations where people were getting their information from social media, which is a really slippery slope and can be a little bit dangerous. So if you happen to get any concerned citizens that have questions on things, direct them to NEMMC. If somebody doesn't want to give us a call, they want us to reach out, please send me the information, and either myself, Kim, or Barry will contact the resident, and we're happy to go over the concerns. If we can't answer them, we can refer them to somebody who can. The pesticide exclusions, we touched on that at the beginning. There's a specific button on our website for that. That's where a resident can go in and request that their property not be treated. Residents who request exclusions of their property must comply with the legal process. Private property owners may request exclusion from wide area applications of pesticides on their property by the district, so by NEMMC. If a tenant is requesting an exclusion, the landlord contact information must be included. The landlord could override that. So if the tenant doesn't want to be sprayed, but the landlord does, the landlord has the final say. Property exclusions cannot be completed for public property. The procedure excludes the entire property from adulticiding and larviciding if the area to be larvicided is 1 acre or more. Areas under an acre may pose a public health nuisance, and larviciding can be completed. Requests must be made to the Massachusetts Department of Agricultural Resources and will go to an effect 14 days from the date it's requested. The reason that it takes 14 days is somebody will either mail in the form or do it online via the website that's listed here. MDR gets it. They send it to us. We have to enter it into our GIS system. That can take up to 14 days. So when our technicians are out doing their residential adulticiding, or as we mentioned earlier, if there was a target spray for a positive virus that was found, it's going to light up into their system to show that, hey, this is an exclusion, shut off your sprayer. That's why it takes the 14 days. These exclusions do expire December 31st of the calendar year. So for exclusions, they do need to be re-entered the following year to stay active. The only time this would be waived is if there's a public health emergency declared by the governor or by the state health department. We receive the property exclusions all the time. There's quite a few in many different communities. A lot of times just people knowing that they can exclude their property, it makes them feel a lot better. They have control over their property when it comes to us. So it's a really good option for the residents to have.
This is just a calendar showing that mosquito control just isn't for the spring and summer months. We are a 365 organization, especially a lot of our wetlands mitigation projects that we do for member communities, as well as other agencies such as Parker River Wildlife, Audubon, Trustees of Reservation, and numerous organizations. We have that special equipment that I mentioned before that we try to get the water moving, restore wetland areas, salt marsh back to their previous ways to help conserve those areas. And I believe that is it for the presentation. And we are open for questions.
Thank you very much, Jennifer, Kimberly, and Barry. That was excellent. I think this is the first time that I can remember we've succeeded in actually having you come and do the slides. We usually miss the window of opportunity, so thank you for coming. So board members, I just want to open it up to our board members for questions. I think I'm going to try and see the whole who's here. Okay, we've got, okay. I don't see Carl yet. Does anyone see Carl? No, okay. So it's just me and Ellen and Amy. I don't have any questions. How about Ellen and Amy?
I don't either. It was very good, very comprehensive. Thank you.
Yeah, it was pretty
You're welcome.
comprehensive. Yeah.
And all this, excuse me, all the information is on our website. The slideshow is in the municipal toolbox. If you ever want it emailed out, just let me know. I'm happy to send it out again. A lot of towns, some of them will present or have it open as well, just for their residents to review.
Okay. And so, John, do you have any questions while we have all these wonderful people here?
I don't have any questions, no. I think that was excellent.
Okay, thank you. Are there any people from Topsfield residents who have questions at this time? Unmute yourself and raise your hand, and now's the time if you have any questions for the mosquito control people. I don't know. I have some different names here. I'm not recognizing anybody. One person is labeled concerned resident. There's a Lisa, a Philip, a G. Neil, Jeff, and Carol. Any questions at all? Nope. All right.
Carol has her hand raised.
Oh, Catherine.
Hi. Yes, I do actually have a question, and that is, what are the specific, so I actually have two questions. So the first one is that in the literature that's published by the State Board of Health, there's like 5 different levels of danger, public health danger, going from nothing to die yesterday. And I'm just wondering how the Topsfield Board of Health determines what the public danger is before using the adulticide. So that's my first question. The second question is, what are the protocols that are used directly in Topsfield in terms of prevention, larvicide? And I'm specifically wondering about the wetlands that abut the Topsfield Fairgrounds. And my third question is, through a public records request last year, I saw that a memo was sent to the Northeast Mosquito Coalition to ask for an annual adulticide program that was submitted by Ms. Winslow to the group. And I'm wondering how that works into public health. Those are my 2 questions.
So I can answer the first one as well. So the Department of Public Health for Massachusetts has categories for arbovirus response and activation. It's low, moderate, high, and critical. The Topsfield Board of Health does not set those guidelines. Those guidelines are set and delivered by the Board of Health, by the DPH, the state health department. So what happens is, and there's several criteria, and they use history, location, proximity to other municipalities, species of mosquito that's positive, whether it's a bird bite or human biter, whether there's animal cases, human cases, how many, if there's one or a cluster. So all that criteria gets set by the Department of Public Health. They notify us, mosquito control. And so we don't set them, and the Board of Health doesn't set them. The actual state public health department sets those risk criteria. And in our integrated pest and vector management plan, which we send out and it's on our website, we have those criteria color coded with the state's response and mosquito control, because we're also the state. So it has the state public health department's response and mosquito control response. So we follow those. And we also give the Board of Health a little tiny 1 sheet on their BMP to follow the criteria set and we follow it regardless. So what happens in the event of a virus, we get notified, and within 2 minutes, the Board of Health gets notified. We contact the Board of Health. We let them know what we're going to be doing. And that's basically it. And if it's something that the public that needs to have, then the Board of Health will either do a public release or the state will do a release. But we usually deal with it on a Board of Health between us and them, because we want to make sure we're handling it in an appropriate manner with considerations and the plans that we have.
So Catherine, did that answer your first question?
No, not precisely. I understand the procedure, but my particular question was directed at Topsfield specifically. What I heard you talk about tonight was that last year you did, I don't know, 30-something testing, 17 testing, and nothing came back positive for any vector-carrying arboviruses.
Yes.
So, and that it has been true for several years now, if I understand correctly. Am I correct on that?
Yes. So what's your specific question?
So if we have had no positive testing of arboviruses, what is the criteria that has been used in Topsfield to do the adulticiding?
So the adulticiding that's done is barrier treatments preventative. So we use a product, it's preventative, because we can't say at any given time that you're not going to have a positive. So what we do is we go into schools, parks, and recreation sites and the fairgrounds. We do a preventative barrier treatment with a product that lasts 90 days. We do it ahead of time so that we can guard against if there's going to be virus. It's not when, it's if there is. And then the areas are protected, and we're not applying barriers when students are in school or people are in parks or people are at the fairgrounds. And especially since the fairgrounds brings horses in. So these are all done preventatively, and we do them ahead of time in the event that there may be virus, because it has historical qualifications.
So then the follow-up question that I have to that, if this is a preventative type of thing, are you doing in Topsfield other kinds of preventative actions that directly implicate the fairgrounds, such as the use of BT to prevent the development of mosquito larvae?
Yes, we do larviciding on a regular basis. And actually, a lot of the times the parking lot in the left quarter of the fairgrounds gets flooded by the river on occasion, and the parking lot will get full. So we go in and check on occasion, and we do larviciding in those areas. We also do it across the street in the field that also gets flooded. There's like a little bridge and a road that follows it. So we go over there. We're always out. Every time there's a rain event, within 1 to 2 days, we go back to our sites that we have, our historical sites that we have mapped on our GIS. We check them and we treat them as needed. So if there's larvae, we treat. Sometimes if we know a storm is coming, we may put granular bacterium down in the event there may be rain. So some high, a lot of our salt marsh sites, like in Winthrop or other areas, we may not be able to get there in time, so we can do a preventative granular treatment on what would be wet when we see a storm coming. So the bacterial larvicide activates when that gets wet, and any mosquitoes that hatch will get eliminated.
Okay, where can I find that data about the specific actions that were taken in Topsfield over the last couple of years?
Oh,
So
that
if you go on to our website, we have all the reports. You go under the report tab. Jen can give you specifics on that, but you can go under report tab and you can see our integrated pest and vector management plan. You can see the best management practices for each town. And in those, you can see we have the first page after the title page has the receipts. It literally has a line item of exactly what was done, where and when, and what product and how much.
Okay, so again, I'm going to refer to the email that was sent last year, and I do not understand how a letter that says annual treatment, annual barrier treatment of parks is part of a health crisis. It doesn't seem to
Catherine?
Yes.
Okay, so one document that I have that is available that I think it's on the NEMIC website, but it's called the 2026 Best Management Practice Plan Report and 2025 Year in Review, Topsfield.
Yeah.
Is that on the NEMIC website for
Yes,
the
it
public?
is.
Yes,
All
it
of our
is.
member communities are on there.
Sorry?
All of our member communities are listed, yes.
Okay, so you want me to say that again, Catherine?
I'll look at the video. Maybe I will send you an email if that's possible.
Do you
Sure.
want me to take your email address and I can send you the link straight to it?
Catherine?
Yes, sure. I believe you have my email address.
I do?
Yeah.
Maybe.
But anyway,
Your last name
I'll-
doesn't show.
Yeah, I'd rather not do it on video.
Okay, that's fine. Do you want to take down our email and then you can just send it to the general email box?
I
I'll
have
send
it,
you
thank
whatever
you.
you need. You have it. Okay, great.
Because, so, I always print my stuff out because here's the list of all the actions that's on the second page of
Mhm.
this. And then there's a 2025 Topsfield mosquito and arborvitae surveillance summary. So that lists all the surveillance. And then there's a list of any positive mosquitoes.
Right, for which
and
we
then-
have not had positive mosquitoes for quite a long time, correct?
I'd just like to add that virus isn't the end all. I'm a father of three boys who's coached football, baseball, basketball in many communities within Essex County. And a lot of those games are, late in the evening when mosquito activity is heightened extremely. And so it's also, our mandate is to protect the public from mosquito nuisance and mosquito control borne virus. So I think it's not an end all, it's a preventative for public health. I just wanted to, to make sure that everybody knew that.
Right, so I guess then really it's a philosophical difference because that's not true in every community. Gloucester, Essex, for example, do not spray.
Right, they're not part of the district.
But they don't spray their playing fields either, so.
Because, yeah.
You know that.
I do know that.
You know that they don't use a private or commercial applicator?
Yes.
Okay.
So back when we moved here 40 something years ago, that you couldn't even walk out your door, you'd be bitten to death by mosquitoes. Topsfield was not part of the mosquito control district. You have to opt into it. But then what happened, it was probably around 2012. There was Tripoli, and a little girl in a neighboring town died of Tripoli. And one of our select people came to the Board of Health, and he was completely distraught over this preventable death. And he said, I know we haven't been part of the mosquito control district, but now I want us to be. How can we do this? And so we said, okay, well, we'll look into it. So we held a public meeting in the Gould Barn, and all of you, in fact, Barry might have even been there.
Yeah.
I don't remember.
It took a town vote, a signed warrant article that gets sent to the State Reclamation Mosquito Control Board. And from there on, Topsfield was in.
Yeah. So the money for this program comes off what they call the cherry sheet, which is money that's returned to towns from the state. So it's just we get less money instead of paying extra money. I can't remember what the exact amount is for Topsfield, but we're opting into the overall plan. We do have the ability to tailor the plan, but there's sort of a default standard protocols, and that's the last page of this paper that I'm looking at. It's called 2026 NEMIC Protocols for District Arboviral Events, and it's divided into 5 categories. The first category is prevention, and and this is where I think the clarity comes in, because under prevention, there's 1, 2, 3, 4, 5, 6, 7 bullets. There's surveillance, larviciding, public notification for personal protection, wetlands management, property inspections, the tire disposal program, and early barrier treatments for public parks, recreation areas, and schools. So that early barrier treatment for those specific things is not in response to elevated virus. It's standard part of prevention. Then you get to the other levels, the next 4 levels. If risk level increases, but no virus, do such and such. Then if bird biting mosquitoes in municipality, what do you do? If human biting mosquitoes in municipality, what do you do? And then if mammal or human case of West Nile virus or Triple E, what do you do then? So I think that was the sticking point, that people were thinking it was only valid to spray in response to some sort of crisis. But this limited barrier spraying is seen under the umbrella of prevention. Am I making any sense with that?
Yeah.
Okay.
But again, I just don't understand that if the testing is going on and is consistent, and there has been no positive sign of arboviruses in any of the known vector areas, why this long-term coated insecticide is used on a standard basis.
Well, when you say
and if it is, and if we're looking at places like red pine swamps, which are the home to these dangerous mosquitoes, are they treated as well?
Okay, now you're above my
So I
which is
understand
zero.
Okay, so the red maple swamp areas and sphagnum bogs are the areas that she's referring to. Those are checked in the winter because those mosquitoes are active as larvae in the winter in the crypts. That was part of our last chart that we showed, where it showed our winter activities. So we check those. If we find larvae, we treat it with a bacterial or an oil, usually oil, because, well, we have to use the oil in the winter because we can't use bacterial larvicides because it's too cold and it's too acidic. So even in those red maple swamps, we can't use any bacteria at all anyway, because it's too acidic for the bacteria to survive. So they die, so the mosquitoes will live. So we use oil on those sites. Well, it's a special BVA or Cocoa Bear, whatever we use. The thing is I only have a certain amount of traps, and we only trap once a week. We're only taking a sample of the entire mosquito population in an area, a sample size. We don't have every square foot of Topsfield covered. We don't test birds. So any given time, it happened 2 years ago, we had Triple E in Haverhill and Amesbury. And right across the border in New Hampshire, they had Triple E. We had no warning. It wasn't in mosquitoes. We didn't have any melanura that were positive. We found out it was the migratory birds that flew in, and they were carrying Triple E, and the local mosquitoes in that week picked it up from the birds, and all of a sudden we had a Triple E event. That's what the preventative is for. We were
Did you spray in Haverhill at that time before the Triple E was found?
I'm sorry, excuse me?
Had you already sprayed in Haverhill before that?
We do some berry treatments, yes, and a lot of the other
barrier treatments weren't effective then.
Schools, parks, and recs. I put my traps out in areas of swamps and bogs. So we're sampling areas that we don't treat for adulticiding. We treat for larvae, but we don't barrier everything. We don't spray adulticide everywhere. We have targeted approach at schools, parks, and recs. And then sometimes some of our towns have residents that call, so we do a weekly adulticide in the towns that allow it. And then if we have a huge outbreak of triple E, we do a citywide or block area spray, which Topsfield had in 2019 without a mosquito. There was so much triple E in in Boxford, West Newbury, Andover, Methuen, Manchester, Amesbury, that whole area. And they had a human case that died in that local,
and traveled through Topsfield.
that traveled through. So even though Topsfield did not have a triple E positive, the risk was critical. And they had a human case, and all the neighboring communities had West Nile, but we still did an area treatment up and down streets in Topsfield. So
Yeah, and I just want to add, it's a regional approach to the district and the 32 other communities. And that's what we pride ourselves on, you know, is of the many, you know, and we do as many things, and we are governed and inspected and as transparent as an organization as I know of, especially when our, you know, if hopefully, Catherine, you've excluded your property so we know where you are and we can add you to our layers. But I will remind you that that is only for us and not any other private or commercial applicator, like the various companies in Topsfield who are treating their homes during the day, every day, all summer long.
That's a good point, because there are a lot of private trucks I see running around town, and we don't regulate them or know where they are, what they're doing, and it's yeah.
Well, they're governed also by pesticide licenses, correct? And I have been told by MDR that if any resident sees someone that is spraying and is not doing that according to the label, so in other words, if pollinators are flying, bees or other things, that's not according to the label, and MDR should be contacted immediately.
By the resident.
So we do have recourse.
well, there are other products that are allowed to be applied during the day. We just don't use them.
Yeah. Yeah. And we choose
They can
not.
spray during the day with a particular product,
Right.
and they do.
Right, but they should be reported to MDR. Suspend, for example, deltamethrin is not approved for use when bees are flying.
Correct.
Mhm.
Yep. The label is the law, and everything we use is regulated by the Mass Pesticide Board. I think we have another question from Carol.
Hi there. My name's Carol McCauley. I'm the Sanctuary Director of the Ipswich River Wildlife Sanctuary in Topsfield. I'm an Ipswich resident. But as the Sanctuary Director, I wanted to just ask a couple of questions. I wonder if the Board of Health, I just wanted to make them aware that there's a coalition represented by groups such as Mass Audubon, the Ipswich River Watershed Association, the Mass Rivers Alliance, and a Mass Beekeepers Association, and others, that currently has two pieces of legislation in this session, one of which has already moved from the House to the Ways and Means Committee, and it's an act establishing an ecologically based mosquito management program in the Commonwealth to protect public health. The Senate version is still held up in committee, but it's in committee. And one of the sponsors in the House is Kristen Kastner, whose coverage is partially in Topsfield. And some of the provisions in it include changes to the policy. I understand we're operating under today's best management practices, today's policy, today's designations and whatnot, but there are a number of folks who think that it should be, that the policies and procedures could be improved. Some of the proposed factors include, obviously using non-chemical methods utilized first. When pesticide use is unavoidable, least toxic chemicals are prioritized. It sounds like that's already happening. Larvicides used only where disease vector mosquitoes are present and source reduction isn't possible. I'm guessing that's, I've heard you talk quite a bit about that. The point that I think that I'm hearing our colleague there sort of get at is adulticides. One of the provisions is adulticides may only be used where less hazardous methods have been implemented and the disease risk is high or critical in the current year per the Department of Public Health. Aerial spraying of adulticides is prohibited and pesticides containing PFAS are prohibited. You probably know that PFAS, I'm sure you're the Board of Health, you know what PFAS are. So I'm wondering, this would suggest that there is some sort of decision threshold and not just preventative. There's trade-offs. We're all full of trade-offs in life, and assessing risk and whatnot. I'm wondering how the Board of Health and how the Mosquito Control District thinks about these provisions of adulticides only being used where disease risk is high or critical, the aerial spraying of adulticides prohibited, and pesticides containing PFAS are prohibited. How would those provisions change or impact your work and the town of Topsfield's public health?
Kimberly, it looks like well, that is questions for the board. John, if you want to jump in, or anybody else, but you're saying this is legislation that's pending now?
Mhm.
So
Yep.
if legislation passes, we would abide by it, obviously. But right now, as far as I know, what NEMIC is doing is the best practice. And if there are better practices, then they'll be revealed and we'll abide by them.
And the town has the ability to assess and take a different level of caution than what the committee, what the district is advising, right?
Well, I would think, but correct me, Nemec, if you need to, but if there's legislation passed and these protocols are no longer acceptable under the legislation, Nemec would have to change protocols.
Correct.
Yeah? Yes?
Yeah,
that
well,
would be,
we're a state
Yep.
agency. We're part of the state. So if the state applies legislation, we also abide by the legislation because we're governed by the same agencies as the state that created the legislation.
So yeah, the protocols would have to change.
Yeah.
Yeah.
So they would change, but and the towns all have the opportunity to decide. I mean, the town has the opportunity to decide to not do the preventative measure now, unless it could follow exactly what NEMIC recommends, or it could decide to do something different. And I think that's part of what's in question. I'd love to ask NEMIC, how do you think public health in Topsfield would change if those provisions were to come to pass?
I think not much would really change. I mean, the methods we use, as you stated earlier, we go right down the line and what we can do first by mitigation, source reduction, larviciding, and then when it comes to it, adulticiding to knock down those adults. And really, the preemptive, proactive approach Topsfield has taken is when we do the barrier treatments in town at the schools and the fields, it's 20 fluid ounces one night a year. That's all we do in Topsfield. Now, comparatively to everything else that's going on in town during the day, I don't know how you could do it for less. But obviously, as things change, new pesticides are introduced through the pesticide board. They get approved through many agencies, inspected, and then through the endangered species program. They do their vetting, and then they let us know when, where, and how we can use those.
Great. I'll just close by saying with almost 100 endangered species in Massachusetts that are invertebrates, the majority of which are insects, moths and butterflies and whatnot, I would encourage the Board of Health to consider a conservative approach and do all it can to mitigate impacts to wildlife while still maintaining public health. If it sounds like that these changes wouldn't really have a noticeable impact, then maybe the Board of Health might consider erring on the side of caution and reducing the barrier spraying. Thanks.
Thank you. That's
you.
a very good suggestion. We will definitely take that into consideration. And we have yet to put in for a request for barrier spraying. So we wanted to hear this presentation first and hear what everybody had to say. And then we can still change what we've done in the past with regard to the barrier spraying. So I thank you for that. And Catherine, thank you for being here and the other people. Is there anybody else who needs to ask a question before these busy people go back home? From Philip, my ask is simple. Take a conservative approach. Spray only when there is a documented high risk. Okay, Philip, thank you. That is duly noted. Thank you for putting that in writing. And this presentation is being recorded, and you can see it probably in a day or two up on the town website. And I really thank you very much, because this once we accept the Board of Health protocol, best management practice plan, which still has room for tweaking as the season progresses, then it goes to the select people, and they're the ones who have to authorize the money. And then what happened last year was they were not aware of all the details, and then we kind of went around in a circle, and they wanted to hear it all again. So now that it's been recorded, they can listen to it.
And
And
we met
anyway,
with them last year to kind of clear up any of those misconceptions and everything else. So that was
say that,
good.
say that
We met
again.
with the select board last
Oh, you did.
year, to close the loop, if you will.
Close the loop, which,
Yeah.
so I hope that isn't a request again this year, or I suppose it could be, but
Yeah, and if it is, we will go and meet with them like we did last year. So
thank you so much, Barry.
yeah, absolutely.
Okay.
And I
Appreciate
just want
it.
to reiterate one more time for anybody who's who didn't want to ask the question or may think of questions after we get off this meeting tonight. Our website, nemassmosquito.org, or our general mailbox is nemmc@mass.gov. Please reach out to us. We can contact you separately, discuss anything further if you want to, if you have more questions. Just don't be shy. Please contact us directly, and we'll get you the information that you need.
And you can also follow up by emailing the Topsfield Board of Health, and we will read all those and take those into consideration as the season progresses. Thank you. John, did you want to say anything?
No, just want to say thank you for the presentations and everything. That was very informative.
Thank you.
All right, thank you.
Thank you very much.
All
Thank you.
right. We will be voting later on in the meeting, and so we'll be in touch. And meantime, we'll just continue with our agenda. Thank you, Jennifer, Barry,
Yes, of course.
Kimberly.
Thank you. It was
Thank
nice
you.
to see everybody.
Great to see everyone.
Thank
Bye.
you.
Have a good
Right.
evening. Thank you.
Okay,
Bye.
bye. Okay. Move my agenda. Ooh. Here it is. Next up on our agenda is meeting minutes from February 18th. How is that possible? It must be March meeting minutes.
It is.
You see what I have? Oops. Ooh. Hmm.
You need
Oh,
me
I
to
know
check
what
the email?
I know what I did. It's March 18th, 2026, those minutes. I have the minutes and I have read them, and I don't have any corrections or additions. How about anybody else? Or Ellen or Amy?
I have no questions or additions.
Okay.
I missed
Amy?
that meeting. I missed that meeting.
So those are the minutes of March 18th, 2026. We're voting to accept them as written or have corrections. Do you have any corrections? Okay, I shall entertain a motion to accept the Topsfield Board of Health minutes from March 18th as written.
So moved.
Is there a second?
Second.
All those and any discussion? All those in favor? Aye. Ellen,
Aye.
Amy?
Aye.
Yeah, thank you very much. The minutes are accepted unanimously as written. Next on the agenda is the health director report. And yeah. Thank John.
Everything's going well. It's definitely, you can tell that the seasons are changing. The engineers have definitely been stopping by. The installers have been coming in. We have a couple systems going in town. right now. They're getting installed. I was out doing a soil evaluation on Monday with Alex Parker, which is always a great time. He's a very really knows his geology well. He's I think one of the most brilliant geologists in the area. Other things we're working on is the SAFI 2.0 Performance Standard Survey. It's about 250 something questions long. It's a requirement the state has asked us to complete. Sue and I have been working on that. It's you know a variety of questions. Like how does the Board of Health regulate this, or do you permit this? Some things don't apply. Like we don't have funeral homes or something like that in town, so not everything applies to us. But then they're also asking for a lot of statistics on how many restaurants you have, how many caterers there are, how many Title V inspections you've done, how many, you know, plan reviews, etc. So it's interesting, but it's definitely very labor intensive. It's definitely something you can't do in one sitting. You kind of get through 50, 75 questions and then come back to it later. And like I said, there's quite a bit of data that we've had to kind of collect to put the numbers into the system. What else is going on? There's quite a couple different distribution boxes going on in town. I've been working with Mike on the post-closure monitoring on the landfill. We have another round of testing for that coming up. I think he said probably we'll do it early May. Um, Another note is we have the new public health nurse. She's supposed to stop by tomorrow to have a meeting with me. So we'll have you guys meet her at some point. Um, yeah, that's good news. And that's about it, really. Non-business related. I'm recovering well from my ACL, so I'm getting there.
Good. We're glad to have you back. Missed you. Thank you, John. Any questions for John? Okay, so let's see. So new business. So now we have discussion and vote and review of the NEMMC 2026 Best Management Practice Plan and Integrated Pest and Vector Management Plan. In order for this to move forward so the selectmen can actually go ahead and release the money, I believe we need to vote to approve the plan in some form and
I think just to opt into the program, right?
opt in. Yeah, we're opting into. We have to confirm that we're opting into this program, and so the document that we're discussing is the one that I already cited earlier in the meeting, the 2026 Best Management Practice Plan and Report, and it looks like that. And so basically, district control measures specific to Topsfield, I'm just going to read them. Adult mosquito surveillance program, vector virus intervention, GIS mapping of mosquito habitats and treatment areas, catch basin treatments, larviciding, and then in parentheses it says resident and/or Board of Health requests. Adulticiding, parentheses, virus intervention only with Board of Health approval. Then it says barrier treatments on school properties, parentheses, school officials / IPM coordinator request. The way John and I understand this is the schools are requesting this barrier treatment. And so, but we need some further clarification on this because of the discussion that we just had.
Yeah, we'll have to touch base with the IPM from the school department. And have a discussion. But obviously, this is really just to take a vote to opt into NEMIC's program for, the season coming up, and we can work on that coming down the road.
So does that mean that the adulticide and the spraying at the schools would only happen on request? It wouldn't be like an automatic thing that would happen?
That's
Yeah, It's on request, but as they kind of mentioned in that PowerPoint, there are certain requirements for schools that they have to follow that aren't necessarily for everywhere else. So I'd
That's
have
a
to touch base.
state level.
Yeah,
Yeah.
I'd have to touch base with the IPM at the school department and see, where they land on that.
But one of the things, the fairground stuff, that is not, that's optional. And so we have to talk to the fairgrounds and see what they want to do. And then make a decision.
Yep.
And then, yeah, it's a little, it's more vague than I would really like it to be. I've spent a lot of time poking around these documents and the websites and everything. I thought this was a good discussion, and so I'm glad we had it because it points out some of the things that might not be clear that we need to work on.
Well, and let's remember the goal is we're voting on an opt-in to the program, which isn't necessarily just spraying. It's also them clearing out stagnant water and
All the
you know
prevention.
different
All the
preventative measures that they take to really help because the Culex species of mosquito really like to sit in those small bodies of water. They're not usually found in larger ones. So anything stagnant, like they were saying, the tires, things like that, is where you usually will find them.
I think I told this story last year. I happened to be home when the Nemec people came to test the wetland across from my house. Um, and so I went outside and spoke with the guy, and he said, well, first they dip into the wetland and take a look. And he said, there are no mosquito larvae in this wetland. There are dragonfly larvae.
Dragonflies, yeah.
And the dragonfly larvae eat the mosquito larvae. So the
Yep.
so when there's a balanced wetland, there aren't even any larvae. So there was no larviciding that needed to be done. Then he went down the street a little further down that little wetland along the side of Brookside, and there were some mosquito larvae. So I think he treated that one. So it's, just
We
very,
hardly have any. Yeah, I think
yeah.
Brookside Road's pretty good for a wetland area.
I mean, when we moved here, you could not go to your mailbox without getting multiple mosquito bites. It was horrendous.
I mean, they're definitely in my yard in Boxford, but we also have an enormous amount of dragonflies in the summer. I don't know if it's all the perennial flowers we have or what, but we just sit in the yard and watch all these cool colored dragonflies. It's pretty cool.
We do too. It's great. There's so much nuance to all of this. I found out, every year I pick up new information. Been on the board for what 23 years or something, and one thing I didn't know was, like, let's say the last year some mosquitoes landed in a flower pot that I left outside, and they laid some eggs. Those eggs can overwinter and hatch and dry up. The flower pot thing can be totally dried, and 8 months later it rains and the eggs wake up, come alive, hatch, and you got mosquitoes.
Oh, gee.
Just that. And you heard him say a bottle cap in your yard. And here we are worried about, tires and swimming pools. A bottle cap. It's amazing.
So for the vote, I just want to make sure that I'm clear on what we're voting on. We're voting on
Oh,
Just
into
being
the
a part
in
part
the
of the
plan,
program.
part of the program, but we're not voting on spraying per se, because there could be spraying that's out of our control on the school grounds that the state determines has to
Yeah.
happen. Or
Right.
there could be our decision at some point because something happens or we notice something, but
Yeah.
we're voting just to vote into the program and not
The
necessarily
program-
those things.
Yeah, the program to
prevention.
take the preventative measures. The larviciding is the main component in their program, and it is one of the most effective ways to lower the population of mosquitoes. And then, yeah, the other stuff is variable depending on risk, if we have to spray because there's human cases in town or, a preventative measure for, public properties.
Okay, so I
So-
mean, I would make a motion based on what we just said that we would be voting in to continue the program. Um,
I have a sample motion if you want.
Oh,
We thought
perfect.
about-
Go for it.
To motion to approve the NEMIC 2026 Integrated Pest and Vector Management Plan and 2026 Best Management Practice Plan for Topsfield to be submitted to the Select Board for their review and approval. That was, what do you
Very
think?
good. I second that.
Okay. Oh, I guess I did make the motion. Uh, is there any further discussion on this? Okay, we will, all those in favor of the motion, say aye. Amy,
Aye.
Ellen,
Aye.
myself, aye. Thank you very much. We will be in touch. We will definitely tweak this as we go along in the season. Whew. Thank you very much for being here for that. All right. Okay, the next thing under new business is fall 2025 landfill monitoring report. Sue was kind enough to print this out for me, and I read every word of it. Took me 2 hours. I don't know if you guys have had the opportunity to read it, but there's a lot of chemistry in here. There are maps of the landfill and surrounding areas and what it is that they're monitoring for. And the big new thing this year, well, actually last year, I guess they added on PFAS testing. And so the landfill was started to be closed in 1997. It was finally closed in 1999. And by law, Massachusetts state law, the local board of health is in charge of monitoring the landfill for 30 years, a minimum of 30 years. And then if problems crop up, it can go on longer. So this PFAS stuff that was added on is new now. And we're kind of just getting into this. So I don't expect this to end when we originally expected it to end, which was in 2028, I guess. Have you, so John, did you want to say some words of introduction?
Yeah, so the PFAS monitoring basically started in our fall cycle, which we're required to do because of the post-closure monitoring permit from DEP. We've been testing for a couple decades now. Really have never had any significant action levels or anything like that at the landfill. But with PFAS being found in water systems basically all across the Commonwealth, and even across the country. It's something they have wanted us to start testing for. The other thing to note too is the action level for that used to be 70 parts per trillion, not billion, trillion. And now it's being lowered to 20. So what that has caused is seeing action levels pretty commonly, basically all over Massachusetts. I was actually just looking in the database today, from the state, and there's something like over, and this is just municipal water tests. This isn't private drinking wells, so you don't even really know the real number, but there was 2,500 to 3,000 action level numbers that have been found all over Massachusetts, whether you're in Wayland or down by the Cape or out west near Springfield or up by us in Essex County. And then if you look at how many samples there are that just have PFAS in the water and you don't have a non-detect, it's basically all over Massachusetts. So it's something we're all kind of learning about as it goes. And we took samples. We did have one house that was slightly above the action level. We are working with DEP and following any guidance they have. And our geologist, Mike Kroskowski, is handling the post-closure monitoring, and we are working with a LSP to basically follow any continuing data collection and testing we have to do.
What's an LSP?
Licensed site professional.
Oh, in addition to Mike, or
Yeah, so he kind of he looks at it from basically the private drinking water aspect. Mike is really handling the post-closure monitoring of the landfill. So that was essentially what we've been doing for um, years. So he's looking at the shallow monitoring wells, not just for PFAS, for any kind of contaminant. He's looking at the methane gas for the passive vents we have, and then also the maintenance of the landfill, making sure they're keeping up with simple things like cutting the grass, et cetera.
so does does anybody have any questions about the report?
So I just had a request maybe for like future reports. It's
Mhm.
just like so dense, and a lot of it was history in the beginning. So I said, okay, I'm going to sit down and read this thing from start to finish, like you did, Cheryl. But I didn't have the time to. It would have been helpful to have like highlights. This is what's like what we did this year, and this is what we found, and this is what something, an executive summary, highlights, something. 70 pages of just, I mean, it was interesting, but I feel like I read that last year too, a lot of that history. So it's just a
Sure.
request.
Well, you know what
Yeah.
I did? I went because it came as a PDF, and you can do an AI search or consult.
Oh,
So
using AI.
well, yeah, the AI said, "Would you like me to summarize this for you?" I said, "Yes,
Woo!
please." And I actually have that pulled up on my computer. I won't go into it, but because anyone can do it, but it was pretty good. You
Well,
know,
because I don't allow my students to use it, I feel like I can't use it, so I don't use
yeah.
it. But good for you, Cheryl. That sounds like a good use of AI.
I mean, it was right there, and you have to take it with a grain of salt. And some of it, I thought maybe they missed some key points, but I guess since well, half of it is appendices, but I guess and then there's appendices and charts and graphs, and you just go back and forth and refresh your mind of what do all the chemical symbols stand for. And we know all of them. We learned about those in chemistry classes. And the maps, there are more maps this year than there have been in the past. And I guess they're looking at the geology, which is underground, how the water flows underground into either towards Pie Brook or away from Pie Brook. I mean, it I think one year we asked Mike to come and sort of summarize the report for us, but um, there was nothing like frighteningly, there were like John just said, there were a couple of little high levels. They don't even know if it's
Yeah,
it,
the thing is, it's called a critical exposure pathway. They don't, in DEP is in agreement on this. And I don't really want to speak for DEP, but they don't know what the whether there's an exposure pathway or not. It looks like there isn't. And it could be that there's contamination just on that street from a different source. We all have to remember that PFAS is in a lot of different things. It's in water repellent gear like a ski coat. It was used in nonstick pans. It was in all kinds of water repellent coatings, firefighting foam, a lot of different products. Unfortunately, now they're looking at it and saying, well, it's essentially a forever chemical and it doesn't basically break down in the soil. So now they're making the standards a lot stricter than what they were back in the day.
Mm-hmm. Yeah. It's just building up.
so. um, I have on my notes here that we don't think a vote is needed, but maybe a consensus that we accept this report from North Coastal Environmental Monitoring so that it can be moved forward to the select people who can then vote to release the money to pay for it, which, by the way, is not in our budget, oddly. And I do want to mention it because it's never been in our budget, and we are the ones doing the monitoring. And I think it got misplaced and it's put into the DPH budget. That was done at least 20 years ago when we weren't even aware of a lot of this stuff. But I think I'm trying to get it put into our budget so that it makes
So
sense.
I actually have an update on that.
Update.
It will be in our budget for next fiscal year. I took care of that today. So
Thank you, John.
I sat down with Amanda because I had to talk to her anyways about the future expenses we may have with the continuing of the testings. And I requested that she did that, and she said she can't do it for this year because they just finalized the budget, but she can do it for next year.
Fabulous. Wow. It only took 23 years. I'm thrilled. Thank you.
It's the little things.
But it really took me all this time to really understand it and be very, very clear that it needs to be in our budget. So now that makes sense. It makes sense. Nevertheless, yeah, right now the select. Well, I was asked to sign for it. That's what happened. And I never was signing for it. And I said, I'm not going to sign for it because it's not in our budget. If you want me to sign for things, it has to be in our budget. So now it will be.
So
But
will it
anyway,
go to the board, the select board, after we take our vote on it, or will our vote be the final vote?
I think they have, well, we have the responsibility for looking at the report and approving it and just assuring that the monitoring is being done and done correctly. That's all that we're assuring. We're not assuring that there's no contamination or anything. We're assuring that we have hired this person and they're doing the work correctly and we're satisfied with. I think that's what we're approving. And then the selectmen have to release the money this year. Have to approve the money.
Okay, so they have to approve all the money.
Yeah.
Okay.
Yeah. So anyway, we can vote or we can just agree that to have a consensus to that we approve of the monitoring being done as written in the Town of Topsfield Sanitary Landfill Fall 2025 Environmental Monitoring Report.
I'm fine with that. I think I would just reiterate that if there was something they could do to highlight sort of what we should be paying attention to here, so it doesn't get buried in 70 pages or whatever of things.
Yeah, I'll have to ask Mike. I
don't know if that's
just want to
possible.
remind everyone, this document is a requirement to be submitted to DEP.
Yeah.
They really are the ones that are regulating this. So all the historical stuff, I'm sure, is required for him, even though it's probably, makes it excessively long.
Yeah. Just an executive summary. I think that would be, that's like kind of an important thing for a really long report. I think they could probably do that.
Oh, thank you. That's a good suggestion. We can certainly ask. But that's a good point too, John. I mean, we're just making sure that this is being done.
Yeah.
Yeah, and if you're a new board member, it's good to see that history. But if you read it last year, then it's just hard to know, where do I start here?
Oh, I guess I didn't remember as I read the whole thing again, but well, okay. Well, I'm just going to declare that there's a consensus because nobody's saying there isn't. Is that fair?
Yeah.
Fair. Okay, good. And the last thing is, discussion and vote on the review of 2026 Open Space and Recreation Report. So this report um, gets done every so often. It's done by the Topsfield Open Space Committee. I don't know if it's every 5 years or 7 years or something. And the last time they did the report, there was some stuff written in it that was, I'll say, misleading about septic regulations. And I remember them asking us questions about septic things, and we answered the questions, and then things got put into the report, and it it I wasn't happy with the way it was written. So this year they sent us a letter from Martha Sanders, co-chair, Topsfield Open Space Committee, CC Melissa Ogden, co-chair, and Sue Winslow. I guess, John, you weren't here yet, maybe. And I don't know what they didn't.
I know I was here for the update, and essentially the update we basically say is that we conform with Title V to, match the state standards and kept it very simple. So,
Right, we took out the confusing language and we said the bottom line is we don't have any different regulations. Our septic regulations match Title V, and Title V is completely adequate to keep the groundwater clean, and that's what we do. And so what I did again, since it was a very nice PDF and you can do a search, I did a search on the words septic, Board of Health, and something else. And it was mentioned about 4 or 5 times, but in totally peripherally, and it basically said just that our regulations match Title V, and Title V is protecting our groundwater. And then it said things like when people are developing land, they need to be cognizant of where they put their septic system and following all the rules so it wouldn't poison the groundwater. And you know, that's basically what it said. So what we want to do is it says here, please let us know if you have any comments or suggested edits. I do not, as soon as possible. If not, please indicate your approval of the 2026 plan by return letter no later than May 15th. And so the suggested motion is a motion to submit a letter of approval for the 2026 Open Space and Recreation Report final draft. That's my motion, I guess.
Second.
Any further discussion? All those in favor? Amy?
Aye.
Ellen?
Aye.
Myself, aye. Thank you very much. I guess, Sue, John will work with Sue to draft a letter, and we can check that box. Okay. Thank you. So old business. So John, you alluded to the public health excellence update. Oh, so the nurse is coming tomorrow. Did they have their health fair?
yeah.
Did you go?
No, I could barely walk.
Oh, that's right. You were, yeah.
I still am walking like a turtle, so I don't know what to tell you.
Well, okay. I didn't hear anything from anybody else. So
Yeah, I don't know. I don't know how it went. The only update I have is Jessica asked me this week if we were using a third party to do the camp inspections, and I told her yes, we are, because I was not sure when the nurse would be onboarded or trained. So
okay. So do you think she'll want to be included in the camp inspector? Well, you don't know.
it didn't sound like it. I think she was just emailing me to confirm that we didn't need her to do them. She is going to be doing some with Connor in Boxford and Middleton. So, next year will be a different story.
Yeah, she should take the opportunity to do one, but that's just my opinion.
Yeah, I can certainly ask her. I mean, but with Julia doing them, I
Oh,
mean,
yeah. Well, maybe best left alone, but
Yeah.
all right. Thank you. Uh, and then Kevin is still our Topsfield representative on the advisory board. He did speak with me and say he wanted to talk about it, but we haven't had a chance to talk about it. But he still feels he has more work to do on that board. So
Has there been another meeting since February?
I don't think so.
I don't think so.
I think they're only required to meet quarterly, which is really the bare minimum. They've really told us we should be meeting monthly, but
Yeah, I thought that had been agreed on, the monthly, but
yeah, that was the suggestion.
yeah.
Well, the
Okay.
other thing too regarding that is that my understanding is Metric will live on, that has funding. So, and also all these reporting um, statistics that you're digging up now are required by law to be reported. So what if the money goes away and the staff goes away, the law remains. We still have to report to the state of all these things that we do, which we never had to do before we got the money. So
Hmm.
they'll take them. The money could go and the requirements can stay. Just a heads up. All right. So, and opioid settlement funds. Oh, um, Julia has been employed by the uh, opioid group for a half an hour a week, I think. Is it a week or a month? A
Yeah.
week. To sort of oversee the spending of the opioid funds because they take votes in the opioid meeting of how to spend it, and then the devil is in the details. They have to do something. The people who ask for the money have to do something and submit an invoice, and then that has to get paid. And Julie is overseeing all that. And of course, it's far more complicated than you could even imagine. And on paper, it looks like we're not doing anything because the money looks like it's not being spent, but these things are taking amazingly long to sort of be processed. Um, and so there's a lot in process
Yeah.
because I went to the last meeting and Ellen went. Did you want to say something, Ellen, other than me? All the time. I know
Well,
you were there and you're a faithful member of the opioid group.
well, I think that they went through some of the budgetary things that the youth mental health first aid training. Uh, there was they were submitting an invoice for $2,000, but the cost is 2,500. But then there was the youth risk behavior survey, etc. So Julia made a motion to add $1,600 to that budget and item, and it was passed. So now their budget is up um, to let's see. I'm not actually sure exactly how much, but it looks like 2,500 plus 1,600, so
4,100?
over $3,000 um, for the first the youth mental health first aid training. So, and then the woman who presented the Living in Color,
Mm-hmm.
she's going to be exhibiting the posters at Zoomies, both locations in August. So,
Okay. Yeah, she had her brother died of an overdose, and she has invented sort of a program using some of his poems and his artwork, and she's turning them into great big posters, and then on the posters will be a link to help so the posters will attract people to look at them. There will
right.
be one blurb of words and then a QR code. They can go right there and find help if they have an addiction problem. It's really very very well done. And
Yeah.
so yeah.
She also has merchandise, jerseys, and hats with a really nice, I guess you'd call it a logo on, the name of her project is Living in the Color. And they're colorful jerseys. And, well, I don't know if you can see, I hold them up.
Oh,
This is what she has.
oh, thank you.
So,
Yes.
so that I'd have to actually look into it to know how, you know, I'm sure they'll be available during the August project, but I'm sure they're available at other times too. So there is a website, loveyourlife777.com. So, and I'm sure all of that will, but there's also a link with the Topsfield website.
Oh, good.
So. And then for the Topsfield Vocational Academy, we've allocated $3,000 for vape detectors for the bathrooms there, for vape detectors. And then CPR and naloxone training for the staff. And I guess the Tri-Town Council is going to be doing CPR and naloxone training for the community.
Oh, good. Thank you, Ellen. That was a nice surprise. I guess I didn't, you took notes. I guess I didn't take any notes.
Yeah.
Oh, very good.
Well,
That's
there had
a-
been concern that, you know, at the meetings that, first of all, a couple of meetings had been canceled over the winter for whatever reason. And now I think they've been rescheduled to Mondays. I think the Thursday meeting was difficult for some people to come. So, but also there had been concern that, you know, things were lingering. We weren't actually allocating the money. And so now it looks as though they're starting to do that.
Yeah, it took a while to get going, and now it's a lot of stuff is in progress.
Yeah.
So, okay, thank you. Well, segueing into bills paid, there were a couple of bills that I signed for, even though I probably shouldn't have signed for opioid money because it's not in our budget. But let's see.
Yeah, I
Bills.
was curious about that. Is it being just kind of comes through our department?
Well, it was uh, in the name of expediting things to make them happen. But you know, I could also make the point that if we're going to be in charge of looking after that money, that maybe it should be in our budget, but it never will be because it's, I believe, under state law, it the town administrators it's in their budget, but I could be wrong.
Mhm.
So, but the two things that I signed for was, as you said, for the Tri-Town Council to do what you said, that was $450. That was Northeast Education Consortium training, YMHFA. I can't remember what that meant. Do you remember YMHFA?
Youth mental health.
There you go.
Training.
There you go.
There you go. Thank you. So that was $450. And then there was, there were, well, somewhere in here, but there were, I don't think it appeared. Wait a minute. The Tri-Town Council, I have Amazon. $614. Yeah, that was these kits where if you have, let's say you have some oxycodone in your medicine cabinet and you want to throw it out, you don't want to flush it in the toilet, and you don't, for some reason, you don't want to go to the police station and put it in their special box. What are you supposed to do with it? So in this, it's a plastic, I was going to bring one to show, but a plastic bag, you put the pills in there, and then there's a gel in there, and then you add water, and it absorbs the pills, and you can then safely put all that in the trash. It's kind of
Oh,
like the
So you have that now, Cheryl?
I don't have it. Julia has them,
Oh,
and we pay. We opioid funds paid for them $614. There was a big box of them in Julia's office, so she took them to like Grove Spring, and she handed them out at Grove Spring. And I don't, and so she travels around a lot. I don't know. Sue probably knows more because she comes in on one day a week, but um, wherever she sees she could hand them out and they could be useful, but she'll hand them out. I remember in the back in the day, weren't we putting like take a coffee can and put used coffee grounds or kitty litter or something in it and put the pills in there? That's what I used to do.
I
Not
still
that
have them. I still have them in my car from my wrist surgery from 2 years ago. I keep saying I'm going to return them to CVS. I never even opened the bag.
Yeah.
But they made me fill the prescription because they said, oh, if you don't fill the prescription on a Saturday, we don't want you to call and not be able to get them.
yeah. Yeah.
But I never even opened the bag. I thought you could just return them to the pharmacy, but
I
maybe
don't
not.
know. That would be handy, wouldn't it? That you should be able to, but you can go in the police station and
I'll
there's
go in the police station then.
yeah, there's
Amy, we have right outside the back door. We also have a new like little kiosk where you can dispose of them safely there.
Oh, okay.
okay. I didn't know
Perfect.
that
That's the easiest.
Yeah, opioids could go in there. I thought that was only over the counter. I must be wrong. Over the counter, no?
I
Anything?
don't know. I can check with Julia and let you know, Amy. Okay.
Okay, thank you.
People have been putting all kinds of medications in there, so I don't know.
Well, they don't take inhalers, which is which is odd. But anyway, there's signs on it that says what can go in there. But yeah,
The police department also would have it too.
police,
So
and
they
you just
don't-
walk into the lobby there
Yeah.
because it's not really staffed. Yeah. So then other bills that we paid were mileage for John and New England Medical Waste, and I believe Board of Health telephones is in here someplace. But I don't see it. Maybe not this month. And then revenue, we took in $1,385, which goes directly into the general fund. Of that, $250 was for food inspection type things, and then $1,135 was Title V related activities. And then the last thing on the agenda is a very unexpected and nice thing happened. Sue says to me one day, "You have a present here. Someone dropped off a present for you," and it was a book. And this was an attachment that was sent out to you. And the name of the book is Ripples of Hope in the Mississippi Delta, Charting the Health Equity Policy Agenda 2025. You may say, well, where is this coming from? Well, what I didn't know is there's an NAACP North Shore branch located in Hamilton, Wenham. And so the person who wrote the book, whose name is David K. Jones, was a professor at Boston University, a public health professor and a health policy researcher and a fierce advocate for social and racial justice. It says, by studying the role of race, class, history, and political policy in Mississippi, David came to understand the underlying structural factors that shape health and disease, identify the policies that drive differences, and how to make changes to improve health outcomes for entire populations. And it goes on to say, because of the position you hold in your community, you were identified, meaning me, as someone who would be interested in reading this book. So, and then it says, we are hosting a community discussion of the book on Monday, May 11th, 2026 at the Beverly Public Library from 6:30 to 8:45 p.m. And we hope you're able to join us in person or via Zoom. We'll discuss the book and reflect on how we might be able to picture systemic changes that could lead to better health outcomes within our North Shore community. And it's signed Dr. Kenan Mackenzie DeFranza, President, NAACP North Shore Branch. I just thought that was a really interesting thing. The book is in the other room. I meant to hold it up. But the incredible thing to me, do you remember a couple of years ago, I think in 2022, in Boston, there was a professor who was jogging and he fell through that's the author of this book. That's
Oh,
that
I don't recognize that name though.
I don't know, but
Because he did a lot of research in the South, but I thought his name, because I knew who he was, but I didn't recognize the name that you just said. What was the name of the author?
David K. Jones.
Oh, David Jones. Yeah, maybe
David
it is
Jones.
David Jones. Yeah.
David Jones.
Yeah, he was on that. He went up a ladder or something, and it was, or not a ladder, but a staircase. Yeah, and it was broken. That was a weird story.
It was
So
it
sad.
wasn't properly, barricaded off. So it said
But there were signs and
it was a
stuff.
sign that stairway is closed. He could access it, and
Yeah,
it
yeah.
rusted through, and
That
and
was
he
a
fell.
shame.
It was terrible. So
So
anyway,
young.
yeah. So his mother is really championing this
Hmm,
book and everything. Um,
that's cool.
it's so cool, and uh, I'm thinking that I mean thinking she could be a speaker at an event because the ironic thing is the very thing that he was studying and trying to prevent is what killed him, which is simply a systemic thing, policy, a rule, an action that should be taken to prevent thing. That's how he died. And frankly, and his book was already written at the time he died. It was in peer review.
Oh, okay.
So now it's published. And I'm happy to pass the book around, but also I think in the attachment it shows a QR code where you can
Oh, right, okay.
scan, you can buy it, or well, I intend to go down to Beverly on Monday, May 11th, just because I can't believe they took the time to come up here, write a note, and bring me a book. How could I not go? So anybody wants to go with me? Who knows? Who knew there was NAACP there? Oh, they all inside the book was a little like a handout on health equity policy and also a Rubik's cube because uh, uh, and there are different colors and they're saying, there's a way to do health equity. You just have to line up all these policies like you would do in a Rubik's cube.
Hmm.
So
He was a smart guy. He was a very smart guy.
Did you ever meet him?
Yeah. And
You
he was
did?
I loved his research. His research was really interesting. Yeah.
Okay, so
So maybe I'll join you. I don't know what my schedule looks like on that day. I'll let you know.
all right. Yeah, because it must all be in the book. The research, that's what's in there.
Yeah.
Yeah.
Yeah. He did these road trips across the country,
Hmm.
Yeah.
looking at the political divide and stuff. It was
Mhm.
really interesting.
Mm-hmm.
Hmm.
So yeah, anyway, that something unexpected and fabulous.
Yeah.
Yeah. So I think that is it. Does anyone else have anything else?
Were you gonna bring up about the meeting, the Mass Association of Boards of Health?
Oh, thank you. Yes. There's Massachusetts Association of Boards of Health, MAHB, is our sort of legal backup, as local boards of health. And every year they hold a big update, and it's an all-day thing, just what we want, Amy, when you've done your work of teaching and to go to an all-day meeting. But it's for the first time they're holding one session in Danvers on Route 1 at the hotel. I think it's the Hilton or whatever that hotel is. But you sign up online. It's $100. It's breakfast and lunch, and then it's a morning session and an afternoon session. Was it last year or the year before Ellen came, and Ellen's friend Rick, who's a lawyer, and it's a lot of legal stuff and amazing stories that you're never going to hear about what's going on in other towns, like what was that one on the South Shore? There's like a nuclear
Oh,
waste.
yeah, nuclear power plant or something down there, yeah.
Yeah. Uh, 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 Crazy things you hear about, and you get an opportunity to ask questions about what's happening right now and why the laws are this way. And it's mostly put on by a lawyer, Cheryl Sabara, who's the MAHB lawyer, and other people other speakers that they get. So I'm planning to go. Apparently, if you sign up, there's a link to sign up. I send it out when I send out the Pulse, there's a link in there. And you don't have to pay them. You just say where the money is going to come from. So I put Jennifer's email address at the Excellence Grant because the Excellence Grant is supposed to pay for this. So anyway, that's what I recommend to do. Ellen, let me know when is that anyway? Do you have that in front of you?
Isn't it May 2nd?
Oh boy, May 2nd. It's a Saturday.
Mhm.
We better hop on and sign up. I haven't heard anything. I think, in the past years, they really don't stress the money and they say, yeah, we'll figure it out. Don't worry about it.
Mhm.
So just sign up if you want to go. It's right here in Danvers, which is huge. We went to Marlboro.
Yeah.
Yeah. Okay. All righty.
We're tired.
You're tired? Motion to adjourn unless there's anything else? Anyone?
Second it.
Okay. All those in favor of adjourning? Amy?
Hi.
Ellen?
Aye.
Myself? Aye. Thank you. I'm